Hello, my name's Michelle Bade,
I'm Mackenzie Zook.
And I'm Micah Turner.
and the topic that we focused on was the impact that vision therapy has on academic performance in children. And a little background information before we jump into our process and our results. Children often struggle academically due to an underlying visual deficit, such as visual motor or visual perception difficulties. This could look like behavior outbursts in the classroom and with the kids like covering up that they're struggling to see and really avoid the academic work that they're having trouble with. Visual motor and visual perception deficits affect the child's ability to understand information being visually presented to them. So this really affects their ability to comprehend reading or even taking math problems from the board and translating them onto their papers. Our question that we focused on during our review was, what is the importance of vision therapy interventions surrounding a child's visual motor and visual perception skills regarding academic performance? And our review was intending to identify the impact that vision therapy has on academic performance for children who have underlying visual deficits that is not recognizable on a vision acuity test.
Some of the databases we used was Google Scholar, ERIC, ProQuest, PubMed, and CINAHL. The search terms used that gave us our results best was vision therapy, children, academic performance, visual perception, academic achievement, and students. The inclusion criteria for this included children with visual deficits, peer-reviewed articles dated from 2012 to the present day, which is 2022. And the exclusion criteria included studies that were focusing on adults and vision therapy, so those were obviously not included. Articles that were not peer-reviewed, and vision therapy interventions that were not relevant to academic performance specifically.
And through this review, we ended up discovering 3 recurring themes. These were behavior and academic performance, advocacy, and intervention. To break these down a little bit more, for behavior and academic performance, articles we analyzed found that there were improvements within the classroom setting when a child had received vision therapy or glasses, and there was also increased engagement in classroom activities as well. And if we look at advocacy, we found that advocating for interventions and therapy programs to take place is super important because there is a current lack of it. We need to also educate parents, teachers, and more on how to catch visual deficits early, and classroom supports and accommodations as well. And if we're looking at interventions in these articles, they had mindfulness programs that they implemented, technology accommodations, classroom modifications, glasses, follow-up meetings with parents and teachers, and also vision therapy. Some of the limitations to our review, however, was a limited time period to conduct this. It's a very extensive topic with a lot of nuanced details, so it would be nice to have more time to gather more information. Limited quantitative data to bolster the qualitative data that we had. A lot of qualitative data talking to parents and teachers and the children, but not as much quantitative data to build that up. But some clinical implications of this review are that OTs and educators really need to become bigger advocates for vision therapy. So OTs can help children get the screenings and support that they need to promote better educational outcomes, because we're super involved in the educational setting, and the earlier we intervene, the better. Suggestions for future research: we should analyze specific visual impairments and what interventions best address them to bring positive outcomes in academic performance. And this helps break down what sort of steps can be taken to bring more success for those with visual deficits.
And this concludes our critical literature review. Thanks for listening.